my name is Autumn Hoffman. My fourth choice is the CNAGame.org, and all you have to do is type that into your browser, and it'll pull you up to this screen. Now this is beyond the classroom, what you really need to know to make it as a CNA. Now I understand that I teach physical therapist assistant, but we are always in that patient communication, and not that we perform the exact same skills, but we are involved in patient care and communicating towards patients. And so this site does a great job in showing critical thinking skills. My hope and goal for this is to also use the abbreviations that are presented in these case studies, reading comprehension of patient's chart, and pulling out questions for students to answer regarding the chart. So my intended use for this is for my students and to give them assignments in and out of the classroom. So I'm going to kind of walk you through how I would use it out of the classroom to have students come up to this website and then walk through scenarios. So let me just start and begin the game here, and then I'll talk about the ISTEs that are incorporated into this assignment and having students use this website. So we're going to click here on begin the game. First time playing gives you an orientation and an introduction. But in the case of time here, I'm just going to give you a quick introduction on how to use this website. So we're going to hit returning player. So you have Elsie, Merle, Richard, Grace, Walter, and Georgina. So you have 6 patients here. Each one of them have their own chart that you can look through. We're going to stop here on Walter. So it gives us his hygiene, meals, his toileting, ambulation, dental, safety concerns, and special nursing instructions. So, it's an individualized plan of care for that patient. So in regards to giving this to students outside of class, I would group them up into 6 groups and give them each a patient name. And in each one of these patient scenarios charts, when we go to visit the resident, you will see there will be a series of situations. I think there's 5 situations with each patient. So I'm going to walk you through the first one and how they go through introducing critical thinking skills and problems that might arise with working with patients. So we'll get started here. We've kind of read through his chart. He's had a CVA. We know that he's non-ambulatory and uses a mechanical lift. So we're going to visit this resident. So the situation here is you and another aide are getting Walter up with a mechanical lift when the aide starts complaining about another resident named Jane and how Jane is so rude, and the aide begins to vent. It takes her so long to get ready. She is never nice to me, and I just can't stand her. What should you do in this situation? So, an aide is talking about another patient in front of Walter. This is not appropriate. So what would be your best action? So out of these 4 response actions, we are going to choose this one. That it's not okay for you to discuss this in here, and that you'll talk to her at another time when it's more appropriate. So it gives you verbal feedback of why that choice was correct and that you did a good job in responding in that way. It also brings in the policies and that you are following policy and procedures. So we're just going to kind of pause that there, and this is another scenario, and they'll walk you through 3 more scenarios regarding Walter. So it is a very useful resource to kind of see that using a virtual environment to practice your patient care skills and your communication skills with patients and understanding what situations might arise. I know some of my students' backgrounds are CNAs or PT techs, and they understand some of those situations that will come up, but some haven't been exposed to this very much. So I really want to try to incorporate this to kind of bring out some of those critical thinking skills. The ISTE is Teacher 1D, and that's for modeling collaborative knowledge construction by engaging and learning with students, colleagues, others in face-to-face and virtual environments. So this is a virtual environment where they're engaging and providing and learning about those patient skills, problems that will occur in using their critical thinking, also with other assignments of practicing their abbreviation and comprehending a chart and being able to pull out information from it. The ISTE for students is 3A. Plan and employ effective research strategies to locate information and other resources for their intellectual or creative pursuits. So this is, using their ability to read those charts, pull out information, gather their resources. They can use a glossary there. So it helps them pull in their intellect and providing the best choice of option in regards to each of these situations. So thank you.